Health officials in Tobago are bracing for an expected increase in visitors on the island for the long Easter weekend and is hoping to keep COVID-19 numbers down. County Medical Officer of Health for Tobago, Dr. Tiffany Hoyte, says while an increase in visitors is positive, citizens must be wary of the transmission of the virus. Sunil Lalla reports.
With the long Easter weekend not too far away, health officials in Tobago say they have been speaking with tourism stakeholders who have indicated that there will be a noted increase in arrivals on the island.
We have an expected occupancy for the upcoming Easter period of 98% of our villas, 76% for apartments, and 67% for the hotels.
Dr. Hoyte says while this is something positive for the economy, citizens must be wary of transmission of the virus. She adds that 30% of all confirmed cases on the island were asymptomatic, which means the virus can spread from person to person without any symptoms present. But she is particularly concerned that tour reef operators may not be adhering to public health regulations.
Persons have started to try and resume full occupancy, which is not supposed to be the case. We want to remind persons that yes, the reef tours are allowed to continue, but not at maximal occupancy.
And epidemiologist Dr. AVERY HINDS reminds that persons should not travel if they are symptomatic.
If you are ill, you may want to postpone the time frame within which you travel. Do not travel while ill, do not travel while feeling stuffy, feverish, having respiratory symptoms of any sort.
Meanwhile, Principal Medical Officer of Institutions Dr. Mariam Abdul Richards says this country has had the lowest hospital occupancy rates for COVID-19 in the past few weeks and hopes that continues.
Our hospital occupancy rates have been under 5% over the last month and actually are at an all-time low now of 2%. These have been the lowest hospital occupancy rates since the May 1st, 2020. Additionally, our ICU and HDU occupancies are currently at 0% and have been at this level for the past 10 days.
Tobago currently has no active cases of COVID-19 on the island and has not reported any new case of the virus since March 3rd. Sunil Lalla, TTT News.
17 new COVID-19 cases have been reported. The Ministry of Health says the cases were from samples taken during the period March 14th to 16th and not the last 24 hours. The number of active cases now stands at 121. There are 5 COVID-19 patients at hospital.